Hi everyone. Now, this topic, it's a very little, I can say a focused topic for a few people. It may not be of use for many people who may not be doing all this. But yes, if you are working in a hospital or a chest physician or a general physician also, it may be of use for you. How to do ultrasound assisted lumbar puncture. Now, ultrasound has made our life very easy, especially in the interventional situations where we have to do some kind of ascitic tap, pleural tap. So here today I'll be talking about how to do an assisted lumbar puncture. I'm not going to tell you things related to the clinical part that we are already aware of. What we are going to talk about is the ultrasound, how sonography can assist you in doing the lumbar puncture. Now, routine things that you do for lumbar puncture, that obviously all the precautions and all you have to follow. The position, usually we all know that it is either lateral decubitus position, or if the patient can sit, then we will do it in sitting position. The probe that you would need depends. No, usually we will be using, ideal probe would be a 5 to 10 megahertz linear probe. That means a high frequency probe, because we are looking at a superficial area. No, the spine is a superficial area for us. Then obese patients, yes, there may be, because there are layers of subcutaneous fat and thick skin over it, so you may need a little lower frequency probe. There you can make use of your routine abdominal probe only, the one that we use, that is around 2.5 to 5 megahertz probes that we have. But somewhere around a frequency of 3.5 is what we use normally for the abdominal scanning, so you can use that. Then how to do it? What you have to do is feel the upper area, the superior most area of the iliac crest, and then join the two with a line. So the superior most portion of the upper border of the iliac crest, you have to join the two, feel both sides and then make a line. This is called the Tuffier's line. Now place your probe transversely along the Tuffier's line. Tuffier's line helps you to know the position of the L4, L5, the level of L4, L5 disc. So what you have to do is place your probe here in the midline. Once after you've drawn the Tuffier's line, then place your probe in the midline here transversely first. When you will place your linear probe transversely, see, I'm just skipping out all the clinical part that is there, the cleaning and everything. I'm not going into that. I'm just telling you the how to use ultrasound for it. So you place the probe transversely like this along the Tuffier's line in the center, in the central part. And now to judge the center, basically, see, we want the area that will be putting the needle to come in the center of the probe. So what we do is we put the probe transversely and then we move right and left till we find, will give her the bony area of the spine. The spinous process gives the dorsal spinous process, that gives a shadow, right? That will give a shadow because it's a bone, so it should come in the center of the screen. When it comes in the center of the screen, you will notice on either side you will see hypoechoic areas with linear striations. Those are the paraspinal muscles, and all those are the paraspinal muscles. So identify and bring the dorsal spine should come in the center of the screen. When it is coming in the center of the screen, automatically you know it is in the center of the probe. Yes, very important point here, that when you are keeping the probe, don't tilt the probe here and there. Keep the probe straight. It should be straight probe. So the probe is straight, and then you move it right and left and get this spinous, the dorsal spine area in the center with a caustic shadow. Once you get this picture, now what you have to do is just put two marks with a pen on either side of the probe. So put a point here and put a point here. One point here, one point here. Now what you do is rotate your probe by 90 degrees. Now whenever you are rotating, normally what we do is the right side should go up. So anyhow, you just move the probe, rotate the probe straight and make it longitudinal now in the same position. And again, the probe has to be kept straight. Don't angle it upwards or downwards. It should be directly perpendicular to the skin of the patient. It should be perpendicular. Then once you've made it longitudinal, now you will see a picture like this. So initially what you were seeing a transverse section of one spinous process, and it was seen like a dot giving a shadow. Now since you have put longitudinally, you will see the upper vertebra also and the lower vertebra also. So you see the dorsal spinous process of the superior vertebra and of the inferior vertebra. So this is the superior vertebra, this is the inferior vertebra. In between the two, you are seeing a hypoechoic area. No, the spinous processes look like a crescent. They have a crescent shape appearance. We all know they are bones, so obviously the anterior surface of the bone is going to reflect the beam, so it will be seen like this. And in between, you see the soft tissue area. That is the interspinous space in between. This is the soft tissue area which you see. Now what you do is, again, once you get this view, and this interspinous area should again come in the center of the screen. So now what you do is, once you get this in the center of the screen, this picture you get, now what you do is you put a mark here on the skin of the patient and a mark here on the skin of the patient, no, on either ends of the probe, just like you did with transverse probe. Then what you do is remove the probe. So you have 4 points, 1, 2, 3, 4. Now join these 2 points, join these 2 points, and wherever they intersect, this is the area where you have to put the lumbar puncture needle. This is your lumbar puncture site. So it makes it very simple. There is no risk. You don't need to identify any deeper structures. Nothing you have to do. Just you have to keep the probe the way I have told you. Mark the 4 points, join these two, and at the intersection, you can just put in the needle and you will be able to do the procedure under guidance. You want to see the needle going inside, you can keep the probe on the side and tilt it. Now you can tilt the probe because you already know the point, and tilt it to see the needle. So this is how you can do lumbar puncture. Thank you.